Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this beautiful December morning. Hawkeye is here with me in the studio today, and we're honored to have Senator Jerry Moran back on today. And we'll turn to the senator in just a moment, but first, Hawkeye.
Could be better.
Yeah, it could be better. Not quite as good.
Not quite as good. We're creeping up there to that 100 point.
We're getting back to the century mark, yeah.
We'd like to stay away. So 93 acute infections today, so that's, up from where we were, several days ago for sure. 47 of those patients are in the ICU and 28 of those still on the ventilator. So a good proportion in the ICU and a good proportion of those on the ventilator, which is, really not good. We still have 62 that are in that recovery phase or after that, 10 days or so after their initial diagnosis. So still 155 patients in the hospital, and 6 of those in that recovery phase are on the ventilator as well. So we would overall like to get those numbers down. I think earlier we were at like 160 total, but we know our acute infections are still kind of seem to be creeping up, and that's not good news. Hays has 31 patients, 28 of those in the acute phase, and then 3 in that recovery phase as well. So their numbers went down a little bit, which is good. And now we're kind of creeping back up too.
So I think that, we've hit this equilibrium. We're kind of hanging right here again, and we really won't know the full effect of Thanksgiving and other major events for probably another few weeks. Yeah. We saw after schools reopened, and again, we don't think it was the actual time in school because we think schools did a great job with the densifying and masking and things of that nature. But rather more interaction just in general within a community, especially outside of school, and whether that was a social event or a sporting event or whatever. But I think that it took about 6 to 8 weeks to really feel the full effect of that, because younger people tend to be more asymptomatic, and then it slowly transmits to older and older generations, and as you get into an older population, we see more hospitalized patients. And I think it may take a while longer for Thanksgiving to really see. I'm going to guess with schools, and this is just pure speculation on my part. Curious to see what you think, Hawk. But in schools, people, you have to get past the younger generation, maybe younger parents into some older parents. Thanksgiving, we may have skipped a lot of that. We may have just had a lot of young people with old people, so we may have already gotten into an older population. So I'm going to guess that it's going to be about 4 to 6 weeks instead of 6 to 8 weeks before we see the peak effect.
Yeah, I mean, I think we agree, because people were looking 1 week after Memorial Day, there's going to be a huge surge. Well, and that didn't happen. That happened, 6 weeks or 8 weeks later. Unfortunately, what we have now is the time between holiday get-togethers from Thanksgiving to Christmas time is much shorter than, say, Memorial Day to the next holiday. So I think you're right on that. Unfortunately, I think it will be sooner, but we have to wait and see. Hopefully it won't, but we know that testing is now increasing, which is good. We think some testing was not being done, especially over that holiday season, but I think more people are able to get out and test now. And then I think cases are creeping up as well. So we know hospitalizations will lag behind that.
And we sort of see it around the United States. So we're dreaming of a Zoom Christmas, right?
And the other thing is, although even if we have seen a decrease in cases, what do we see? 3,000 deaths yesterday?
Yeah.
So we know those deaths are lagging behind those cases that occurred probably 4, 5, 6 weeks ago.
Yep. Senator Moran, welcome back to the program again. It is a delight and an honor to have you back. It always is. We really enjoy it when you're here. Thanks for taking time out. I think you have some updates for us.
Well, I'm pleased to be with you, Dr. Hawkinson, Dr. Stites. Thank you for the opportunity of returning to this press conference. Updates. I mean, I would say I'm particularly pleased to be here on a week in which we are expecting the vaccine to be arriving in our state. It's a day that Kansans, Americans have been waiting for. I suppose it is, perhaps the beginning of the end, but it is also a reminder that we are not, anyways, as your statistics demonstrate, and the lies behind those statistics demonstrate, we're not any place close to being over with COVID. And I think early on when we talked on this program, back when Congress was legislating to try to respond to COVID-19, I think many of us believed that we were trying to tide Americans over, improve their health, improve their economic circumstances, and it would take a couple of months. And so we were just trying to fill in the gap. And that couple months has lasted much longer, and the efforts continue. And in fact, so while this week is to be celebrated with a vaccine, I would take us back to the days in which we were legislating in April and May, and the success of the vaccine process in significant part as a result of legislation, the CARES Act, which provided $10 billion for the development and manufacturing of the vaccine. And you all would know this better than I, but it seems to me this is a rapid response and never quick enough. But science and medicine is presumably coming through for an assistance, a help to combating COVID-19. And we're in the process just having the trials occurring. We're now in the process of manufacturing the vaccine. And I think it's one of the smart things that this Operation Warp Speed provided was, in addition to the science and medicine of developing the vaccine, if we get something that looks promising, let's start manufacturing. So when it's proven, it's available. And so there's not much of a gap between those test trials, FDA potential approval, and the vaccine being available, a matter of a couple of days, really. And I think that's something that, I'm a smart enough politician not to brag very often about what government does, but this seems to be a success story. And your opinion of that is more important than mine, and I'd be delighted to hear. And then the other update is that I would expect Congress between now and the end of next week to pass what generally we've been calling Phase 4, another legislative endeavor to try to help Kansans and Americans meet the continuing challenges of COVID-19, both on the healthcare side and on the economic, the job and business side of the consequences of COVID. So there are some things that have happened that I think were good. And again, it's a rarity that you often get to brag about the work of Congress or something that occurs in Washington, D.C. And then secondly, if I'm correct in my estimation, we should be able to provide some additional help in testing, in personal protection equipment, and in the logistics of the vaccine, as well as trying to help the Kansas and Americans in regard to their economic situation, keeping businesses open and people employed. So that's around the corner. Having said all those perhaps complimentary things about a couple of things Congress did, I would put the thank you and the gratitude right back to our healthcare providers in Kansas, to our hospitals, personnel, those who are, as we say, on the front line, what tremendous challenges they face. And I know from conversations I have with Kansans and what I read in the press and see in the media, the number of hospitals that are really struggling to keep up with the demand for their services. And we want to be helpful in that regard. Two things I'd say about today, maybe about yesterday. Yesterday, I chaired a hearing with the Department of Veterans Affairs and had their the Undersecretary for Health with us to testify about the response in the past and the response in the future for the Department of Veterans Affairs. And when I leave this program, I go to a Commerce Committee hearing in which the testimony, the discussion is about the logistics of the vaccine distribution. So again, yesterday and today are filled here in my life in Washington, D.C. With work related to COVID-19.
And just to say, we do appreciate your hard work around that. You've been such a great ally for Kansas. And I'll just say it, I'm a Trekkie, so warp speed means a lot to me. And I don't think there's any question but that we've moved at warp speed with vaccine development. I think it's been it should serve as a great reminder of how government can function for the common good. The United States has led the world in this vaccine development, and our warp speed will not just impact America, but it's going to impact the world. And I think we've really been a great help. I think that the biotechnology industry has really responded brilliantly, and I think the spends to try and advance that they were just, they're going to prove to be dead on right. And when you look at
Dr. Stites,
please.
Dr. Stites, excuse me. Remember, we had a guest. I invited Francis Collins, the director of NIH, to visit with the University of Kansas Health System.
I remember that.
Great surprise and pleasure, I think, when he indicated he was predicting a vaccine in the November timeframe. And I remember you telling me that was very, pleasing, somewhat surprising. It seemed faster than what you had hoped or what you thought might happen. That's not what you hoped, but what you thought might happen. And it is the December, and that prediction is reasonably accurate. in which it appears there's going to be a vaccine available for at least some Kansans and Americans pretty shortly.
Yeah, we expect to be giving it next week, and that that brings to when I saw the FDA's preliminary review of the Pfizer data saying they met their clinical endpoints successfully. I started to cry. I mean, I can't tell you how meaningful that is and what a difference it is, because, as you said, it's the beginning of the end, and I might change the phrase to say it's the beginning of a new beginning, in that without it, we're going to be stuck with COVID for a very long time. But with it, and with a vaccine that's 95%, 90 to 95% effective, we're going to beat COVID, and that's a big deal to be able to say. And we had Dr. Greg Pollan earlier this week, the developer of the head of vaccine research at Mayo Clinic, and his lab has been involved with a lot of the vaccinology, and I think that what was impressive, as he pointed out, we've had other messenger RNA vaccines. The first SARS vaccine for SARS-CoV-1 is a messenger RNA. It took 4 years to develop, and this one's taken us 9 or 10 months to develop. That is warp speed. Someday we'll look back on saying that's slow, but right now, that's remarkable.
Yeah, absolutely. I think it's warp speed not only with the relationship of the government and these biotech firms creating all of this fast knowledge that we've been able to do, but it's warp speed on the clinical side as well.
Absolutely.
From when the pandemic started in the United States, the mortality rates, the clinical knowledge about use of old drugs, so anticoagulation blood thinners, because we knew that now you are developing these blood clots, small and large, in your lung and other places in your body. But it's the repurposing of that steroid, that drug that we have used for forever, in the right time to do that. So I think that clinical knowledge, and then the warp speed with the vaccine, I think it's all remarkable. And I don't think that any other time point in history you're going to be able to have that combination of clinical knowledge and biotech and development of new vaccines such as this, from the start of these vaccines till now where we're at today, I think is just incredible.
Yeah, and to borrow from the Star Trek lexicon, as Dr. McCoy would say, darn it. Well, he actually never said darn it, but we'll be good. It's public television. Families are watching. Darn it, Jim. I'm a doctor, not a physicist or economist or politician or any of those things. So I don't, that all I can say is, as a citizen, I think the money coming out for small businesses and things like that, that has been remarkable, because you see the economy under such stress, and yet, you just feel if we could just get the vaccine and get people to return a little bit to normal, it just feels pent up, and I think that's a really good thing. But the other comment I would make is, if you look at science and where warp speed was really successful, it still takes time to recruit into trials, right? That's a defined time to get those timelines done. Yeah. So the science side of this, to get the vaccines developed in the labs into the point you can do a clinical trial, that was warp 8. I mean, that was really a fast warp speed. So I do think government and biotech and industry and everybody, folks get a lot of credit. And it's a credit to the American scientific engine that we were able to take advantage of that, and the government had the foresight to do that. So yes, I do want to say.
And all those volunteers for those trials.
Oh my gosh, that's
putting
a huge
themselves,
deal.
Ahead of their fellow citizens to try and gain some of this knowledge to help improve our quality of life here coming down the line.
Senator, when do you think essential capital workers will be getting the vaccine? And I'm going to include you. I think you're essential.
I don't know. I appreciate you saying that. There is no time frame that I've been made aware of for what might happen in Washington, D.C. All the focus, certainly in my world and in our office, my conversations with my colleagues has been getting the vaccine to, in our case, Kansas. And of course, the prioritization has been left to the states. I spent a little time Saturday morning with the Secretary of the Kansas Department of Health and Environment, Dr. Lee Norman, and visiting with him about the Kansas plan so that I'd be knowledgeable. But the decisions are not made in Washington, D.C. who goes first. And I guess the prioritization in Kansas, as you all would know, is healthcare workers who are involved in hospital care and clinic care for COVID patients across the state, followed by nursing home and assisted living environments. And then I think the age of 65 and above is next in line. But no talk in Washington, D.C. about a vaccine for the folks who work here.
So one of the questions I think we've also had is if you had a message to Kansans about vaccination and the pillars of infection control. And don't worry, I'm going to answer that question as well.
If I had a message?
Yes.
So, I mean, I would, I'm one who's going to trust science and medicine, and I would encourage people to be vaccinated. I don't think it's my job to force people to be vaccinated. In fact, I'm quite sure it's not. But I would say that I would take the vaccine when it's my time, when my prioritization comes up. I'm happy to do it publicly and to encourage people to follow suit. As I said on this and on masking and distancing and personal responsibility, I recognize that elected officials, their level of credibility is reasonably low. And I just encourage people to ask the physician who took their appendix out, or who took care of you in the emergency room when you had a car accident. Take the people that have you can trust, take the people that you know, the people that you have trusted in the past, and ask them what they would do, what you should do, and follow that advice. So while I'm willing to be an example of somebody being vaccinated, I would encourage people to ask the questions of the person that has perhaps saved their life, or stitched up their kids, or gave them the vaccination for the flu. Ask them what you should do in this circumstance, and follow the science and medicine behind this opportunity.
Yeah, I think that's right. And I think for our message is that, get the vaccination. We think it's going to be safe. And what we've said is earlier in this week that faith, hope, and science, when woven together, are an incredible combination. And I think that's exactly where we are. We've had hope, and I think hope has helped sustain us. We've had to have faith in our institutions, in our spiritual lives, and in science. And I think the science itself is credible, it is good, and it is true. And when you weave those things together, you can really create an outstanding chain that will allow us to get safe. And this is the beginning of a new beginning. It's the beginning of vaccination and getting everybody convinced that this is the right thing to do, that we can achieve herd immunity. And when we do that, we can get rid of coronavirus just like we got rid of smallpox. And man, I can't wait to be in Royal Stadium without a mask, in a crowd, high-fiving everybody, and doing the same thing when Mahomes throws another touchdown pass. I can't wait to do that. That is so much fun. And I know all of Americans share their gratitude for saying it has been a great team effort to get us back to the beginning of the beginning, and that's a great spot.
Dr. Stites, we may have said this before, but I watched the University of Kansas basketball team this week, and it reminded me of what we lost last year when we had the #1 team in the country, and we didn't get the championship game to be played. There are lots of reasons, and to be more serious, I mean, we have our first grandchildren in our lives, a grandson delivered by one of our daughters in January, and a granddaughter delivered by our other daughter in November. We want to have a normal relationship. We want to hold those kids. We want to be near them. We want to share Thanksgiving and Christmas with them. There is so much that can be gained by personal responsibility and the vaccination that helps get us back to things that we would call normal. But it is also helping us be human beings with one another once again, and not having to do all the things that have been necessary to prevent the spread of the virus. The vaccine is a hugely important component of getting us to normal, which is what my constituents tell me they are so anxious for, and for which I and Raba share that desire. We want normal. We had Thanksgiving dinner in our house, and Raba ate at the dining room table and I ate at the kitchen table. I mean, this is not right. And we did not, share a meal with our kids. And now that we're waiting to see a new granddaughter, one that Raba and I would like to hold, this is a moment in which there's lots of good things that can happen as this vaccine takes its effect across the country.
Well, one thing I do notice is that you're not in the basement today, so you're above ground. Yeah, I think you're right. The song "I'm Dreaming of a Zoom Christmas" it doesn't have the same ring as White Christmas. I don't think. Let's see what reporter questions are on the line. I'm not hearing any, Jill.
Yeah, well, they're deciding
There we
or
go.
finding their unmute. Did somebody unmute?
Yeah, this is Matt Fleener from KMBC. This
Matt.
question is for the senator and doctors, if you could maybe answer this as well. Can you provide any insight on some of the steps taken at a federal level to secure the supply chain for vaccines? We've seen some reporting on some criminals or some cyber attackers, potentially doing some nefarious things to disrupt the process. And I know it's so important to make sure that that supply chain is protected, not only across the United States, but here in Kansas and Missouri.
Well, absolutely. And you raise a topic that is not often thought about or discussed, but you will notice that there's a few things happening in Kansas about location that are not being made public due to security concerns. I have been briefed and made aware of concerns in the cyber world, even in our state, as to somebody who's trying or bodies who are trying to intrude in a cyber way to make the distribution more challenging. And so the efforts by our law enforcement agencies nationwide have increased. I'm the chairman of the committee that appropriates for the law enforcement agencies, and they are fully tasked with doing everything they can to prevent the cyber attacks. It's a challenge in this instance and in every other instance about the capabilities of those who attack us through cyber capabilities. And the Department of Homeland Security has a significant responsibility that they're pursuing, trying to protect the logistics. Again, I will be in a hearing as soon as I depart all of you, generally with on the topic of how can it be distributed. And there's lots of, this is certainly one of the challenges, but the doctors would know the difficulties with the need for the Pfizer vaccine to be stored at significantly cold temperatures, something that's pretty uncommon. And it just creates, my understanding is that the transportation of the vaccine will not occur will only occur by either the drug companies distributing or a contractor that they have hired to distribute. And my understanding in Kansas is as the vaccine is distributed across our state, for example, to hospitals and clinics, it will be the responsibility of the Kansas Department of Health and Environment. So it seems to me that the effort is to keep the control and the security, if something goes wrong, that it's all in the hands of the healthcare professionals or those they've contracted with to deliver. I'll know a little bit more about this topic. I'm asked for a classified briefing in regard to cyber attacks or cyber security on this topic, and I'll know a little bit more about the logistics following the hearing that starts at 10 o'clock this morning.
Hawk, anything you want to add to that?
Yeah, we have worked very closely with KDHE and Secretary Norman because we know that there is confidential or classified information. We haven't been privy to all of that, but even what we have been privy to, you heard today on our physician-wide meeting that, we were unable to even tell internally our physicians some of the information because it is, so secretive and classified. And we want to just make sure that, number one, all those places, those distribution places can get the supply of vaccine that they're supposed to get. And once they get it, that it is safe. So I think there is a high level of not secrecy, but just making sure that we're all careful so that those things don't happen. And we can, once we get the vaccine, be able to distribute it as we need to.
And we know that once it comes to room temperature, you got 2 hours to give it or you have to throw it away. So there is a lot of logistics in this. And it has to be kept at a very cold temperature. Then once it gets sent out, it can be refrigerated for 2 days. Is that right, or 5?
Yeah, and they've just updated saying that it is probably it's probably more stable a little bit longer than initially at those different temperatures, at the transport temperature, at the room temperature, or sitting out temperature. So they've just updated them.
Lots to think about. There are more logistical challenges with that one, less with the Moderna, and then if the Johnson & Johnson and the AstraZeneca one come to pass, and the jury's still out on that a little bit, but if those come to pass, those are very easy. That's more like a standard vaccine and very easy to distribute. Other questions from reporters?
Yes, hi. This is John Shorman from the Star. Question for the senator. Yesterday, Lee Norman had shared that he had some concerns with the data use agreement that the CDC is requesting the states to sign that would turn over some personal information regarding vaccine recipients to the CDC for, I think, in terms of making sure people get their second dose at the right time and that kind of thing. But there's some concern that maybe people might be concerned about how that data might be used or whether that might be shared with other agencies. I'm just curious if you've had any discussions with the CDC or the administration about that, or if you've taken a look at some of those concerns.
Jonathan, from my perspective, to me, your question is just, it's a little early. I just learned of this issue from the Kansas Department of Health and Environment this morning. My staff apparently yesterday late afternoon. And so we will follow up with Kansas Department of Health and Environment and see if there is a request for us to engage with the Center for Disease Control. I know Dr. Redfield well. I'm happy to try to find out any information, and I certainly would want Kansans' privacy protected. I think the important thing probably here is, and I'd leave this to the doctors, but this is a two-step process. You need a vaccination now, and you need one several weeks from now. And so the records, as I understood from my conversations with Dr. Norman, the records of the vaccine would be maintained by the healthcare provider that gave you the vaccine, and it would be their responsibility to then notify you, remind you of the need to return for the second dose. But I may be speaking out of insufficient knowledge of this topic, and I'd turn that over to the doctors and see what they know.
But yeah, and what I can say is I don't know how that question between the CDC and KDHE is going to run. I just don't know enough about that. But what I can tell you is that we will absolutely be notifying. In fact, when you get your vaccination here at KU, when you get a vaccination, you will have a return appointment made at 21 days with Pfizer and 48 days with whatever the 28 and 21 days between Moderna and Pfizer. You're going to have your follow-up appointment made, and then you'll get a reminder about that, because we want you to get both doses, and that's how we're going to really get to herd immunity. Otherwise, the vaccine, at least the Pfizer one, is about 60 to 80% effective if you've only had one shot. 60% is a little lower than we would like. That's like influenza, and it's okay. It's not going to get us where we want to be. 95%, that's what we want you to do, and so we want you to get both shots. We're going to work hard to do that. Other questions? Not hearing any. Jill?
Yeah, so I have about 5 reporter questions, and then the community questions are streaming in, so we'll go as far as we can go. First, Senator, a follow-up question from Mary with the Wyandotte Daily. She wanted to know, if a stimulus package goes forward, is there any insight into what individuals and businesses might expect to receive?
There is insight, and there is slowly becoming what we would call here legislative text, so actually words on paper instead of just broad categories. But the expectation is that any package that we pass would include an extension or an additional dose of the PPP program, the Paycheck Protection Program, which I think is another example of something that actually worked pretty well for Kansas businesses and their employees. This is the program with the SBA that you can borrow money, and if you keep your employees employed and you hire them back, that loan becomes a grant. It gets forgiven, and I would expect that to be a continued program. There is, depending upon which version of the bill, there is still interest on the part of my colleagues to do more in regard to unemployment insurance. And that's been an issue that people raise with me somewhat regularly. Will there still be a bonus? It's created some problems for businesses in rehiring people, but there is general sentiment among my colleagues that would be included. And the president the president or the administration is negotiating with the Congress to include this a payment to individuals. So the two things that one I think is the least certain of what might be included. And then in addition to that, I mean, I think those would be the general economic things, is continuation of the Paycheck Protection Program. My view is that we ought to focus a lot of effort on the healthcare side and we ought to focus a lot of effort on the businesses, particularly small businesses that have slipped through the cracks. And in my view, in my world, that's restaurants, it's motels, it's commercial property, retail establishments, places that a theater, places that have to draw a crowd that simply can't draw a crowd today. We do not want their employees. We do not want the business to go out of business. I was thinking about this, Mary, the consequences of Kansas as I've seen what COVID has done in its new spread, and it started with this recognition that many of our communities across Kansas, if we lose a business, certainly if we lose a hospital to COVID-19 and the costs associated with it, the inability to have business, those businesses don't come back. It's pretty unlikely in many communities across Kansas, if the local cafe closes because of COVID-19 or the local hardware store goes out of business, they don't come back. And I know that that's true in the communities that you cover. It's true in communities that I represent. And so we need to do more in regard to keeping people employed and businesses open. And again, I give the doctors, I don't know if they'd say it like I think it and will say, I want to do everything I can. I do not want us, we cannot afford to have a shutdown in which people are isolated at home and can't go about doing business. We need kids in the classroom learning and parents able to go to work because their kids are in the classroom. And so the things that we do with personal responsibility, the things that the vaccine and testing provide is all designed in my world, certainly to have people healthier, to get people well, to get people to avoid getting sick. But in addition to that, it's to keep businesses going so people can continue to be employed.
Yeah, I think one of the things we've tried to stay consistent in this program, there's clearly your physical health, but there's also your mental health. And the only way to meet those two worlds meet is to follow the pillars of infection control. You can keep businesses open as long as you follow the rules of infection control. Wear a mask, keep your distance, de-densify, wash your hands, don't go out if you're sick. And I think if we really followed those, we'd be a lot better off, and we wouldn't have this widespread community spread that we have right now. And so I think that's really the key. And I a lot of the grocery stores are still doing pretty well, and I don't think grocery stores are necessarily a site of massive of spread. But I also think they do a really good job of having masks on. And I turn to our hospitals. We haven't had to close our business, right? But there is no more dangerous spot in the country than the COVID ward of a hospital. And yet we don't see spread. Why is that? We follow the rules of infection control. The rules work. What doesn't work is when people don't follow the rules. That's when you get widespread community transmission. And it's funny to me, not funny, it just hurts that we don't have to shut down the economy if you follow the rules. And we prove it every darn day in a hospital. And yet for some reason we can't get traction around that. People want to be a mask denier or act like it doesn't exist or take chances. Just wear the darn cloth over your face. It's really not that hard. And we do it every day in the hospital, and we keep our patients safe, we keep our employees safe, we keep our visitors safe. You can keep things open just like we keep a hospital open, but you got to wear the mask, you got to follow the rules. Next question.
Senator Ellen McNamara with KCTV5 wants to know, would you take the shot on camera?
I've indicated I would take it publicly. I don't know. I guess that's on camera. So the answer to that question is yes. I don't know that it's been posed to me exactly that way, but I'm happy to demonstrate in front of Kansans, Americans, that I am being vaccinated and am comfortable with that, and in that way encourage others to do the same.
Senator, we've said all along that we know everybody wants to see my biceps and Hawkeye's biceps, well, at least Hawkeye's biceps. And we would take this shot on camera when it's our turn. When it's our turn.
Thank you for highlighting. I hadn't thought about where the vaccine might be given. If the answer is my bicep, that's nothing to show, but it's better than other places. So, yes, assuming that it's in the shot of the arm, I'm happy to have that done publicly and on camera.
That's where it is, and I know you work out a lot, so I'm sure it'll be good.
Ellen has a follow-up question. She says that every public health official has urged the American public to wear a mask. She wonders, how do you bring Kansans and the Metro together over, for some, it is a political issue?
Yeah.
How do you bridge that divide?
Past the politics? Thoughts about that, Senator Moran?
Well, I mean, I have attempted in every way possible to encourage. I mean, I think there is a discussion about who can tell us to wear a mask, but in the absence of that, there ought to be a recognition that masks have value. And it, in many ways, is hard for me to understand why that is still something that is so debated or so fought in places across our state. I indicated that as I thought about Kansas and we lose a business, it's not going to return. I also would point out that just the number of times in the last few weeks that people I know across the state, I've gotten acquainted with lots of community leaders in my time as an elected official. And I just, when I get a notice or I see an obituary in the paper, they don't always say the cause of their death, but often they do. And it's just so many instances in which people I know who are pillars of the community, I'm not suggesting that anyone's life is more important than anyone else's, but people who are important to the future of a community, we're losing them. And I think this is just a matter of a person making the decision that for their own well-being, for their family's well-being, for the well-being of the community, a person is going to do the things that reduce the likelihood that the virus is spread from one person to another. I've had people tell me that, Jerry, I'm a Christian. When God calls me, I'm ready to go. I don't need to wear a mask because I'm in that circumstance. And I understand that, but there's also the great biblical admonition about love your neighbor. And so we've learned through science, this is, yes, about us and our safety when we wear a mask, but it's also dominated by the fact that it's about the safety of other people. And I don't know how to explain the reluctance. None of us like wearing a mask. I would tell you that I appeared in a photograph in public in which I thought I was socially distanced, but no mask on. This is months ago. And it was brought home to me, and I used this example earlier in our conversation. I had lots of constituents who criticized me for that circumstance. The one that was most compelling was a text that I received that said, "Dear Dad, do you ever want to hold your grandson again? Wear the mask." And it's been my attempt ever since to try to make certain that I do what's safe for me, my family, my community, and what presumably sets a good example for others. I try not to be preachy. I'm not in the business of trying to tell people what they ought to do with their lives, but I'm trying to lead. I hate to hold myself out that way. So I just will try to do the things that increase the recognition that wearing a mask, socially distancing, is a valuable thing, not only to the person who's doing so, but to everybody else.
Yeah, I'm reminded, Senator, you'll appreciate this, that the opening of the Constitution does not say, I myself can do what I want. It says, we, the people of the United States, to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty. That sounds like freedom with responsibility to me.
We have responsibility. With freedom comes responsibility, is the way I'd say that. But you're a better wordsmith on almost every circumstance than I've been in this program and otherwise. And so I would say with freedom comes a responsibility.
Yeah, absolutely. And you know, you can't go burn a building down just because you want to. You can't go drive your car into a crowd of people just because you want to. Think about a mask as a way to keep others safe. It's the best expression of that biblical admonition. It's the best way to say I love you.
I didn't tell my story very well because I didn't communicate very well. But as I look across Kansas and see people that I know who have died from COVID, I read their obituaries, I send notes to their families. It is prevalent, and it's something that I didn't see early on. So it is, again, we thought this was a couple months back in the beginning. We thought this would be gone in a couple of months. The consequences, as I see them in Kansas, have only increased in significant ways, and it's about real people. I spend a community spends a lot of time trying to keep their hospital doors open in rural Kansas, and yet to read about, you know, a doctor, the only doctor in town who dies of COVID. How difficult is it to recruit another doctor back to a small community in Kansas? It's really challenging. And how do we care for patients today if the doctor is no longer living in that community? And so all the things that we care about as far as our future they get sidetracked. They get harmed by our inability or unwillingness to try to do all the things that prevent the spread of COVID. We will have a lot of things to do to try to make life good again, even when this is over.
Senator, that's a good segue into Corey Lynn, who is a writer for the Fort Hays State University's Tiger Media Network. Corey wants the panel to talk about the current job climate for healthcare workers and the impact of the pandemic.
You want me to lead on that, Senator? I could talk about that for a while.
You'd be the person to speak about it. What I would say is that the challenge is we generally have beds in Kansas in hospitals across our state to care for patients, but what we don't have is the personnel to care for the patients in those beds, and so we don't have staffed beds. And I see and get calls, and I'm reminded of people who want help getting their family member to be transported to another hospital to be cared for in an ICU unit, and yet they can't place the transfer because there's just not enough people. So the crisis we face today is related to the lack of healthcare professionals who, many of whom are absent because of COVID in their family, testing positive, isolating kids at home from school. And so we face a challenge today, and I would just encourage people to be so respectful of our healthcare professionals, because we want to encourage young people to enter this profession, and we ought to honor and esteem. And again, I grew up in a really small town. The most admired person in town was the hometown physician. He was the most important person in our community, and everybody went out of their way to make sure that that doctor knew how important they were to them and to their neighbors. And it's important for us to do that today in the way we conduct ourselves and what we say and how respectful we are, because I want to be in a position in which we can encourage Kansans to become medical healthcare providers today and in the future. And the challenges that they're seeing today, I hope, don't discourage them from that career.
Yeah, thank you for saying that, Senator. And I would say that we need more people going into healthcare. Even before this, there was a shortage of healthcare personnel. I think we currently have around 2,000 jobs open here at the University of Kansas Health System. We're a great employer. I mean, we do a great job taking care of our people. We need folks, and I think that's true everywhere. We can't get enough staff beds, and we have that chief medical officer call, and we're all trying to find staff. There is no question about that. So there are lots of jobs in healthcare. It's a great profession. It's got great longevity. And you get to take care of good people, and that's a great job.
All right, our last media question comes from, it's the same one that Donna Pittman with KMBC has. It's also the one that Matt has up in St. Joseph with News Now. And it's a question that many of the people that are on the thread today have. And that is, can you please define any more about the allergic reaction out of Great Britain to the vaccine? Who needs to be concerned about that?
Let's take that on, Hawk. You know, as I understand it, and then you can tell us the rest of the story. But when Pfizer did their study, and you can already see this in the publicly released data, the rate of allergic reactions in the 30,000 people who were tested, 15,000 placebo, 15,000 people got drug. The rate of allergic reaction was almost identical between the placebo group and those who got the vaccine.
Yeah.
Now, we've heard about 2 people in Great Britain who got it, but all we know is that they had some type of an allergic reaction. We don't know much more about it than that.
Yeah, you know, it was so important that even the New England Journal of Medicine put out a commentary that day. So that's pretty important, because usually they lag behind when they're actually reading scientific articles. But, you know, we don't know any more information about that other than what was reported in the news stories. So I think it's important to understand, number one, where were these 2 patients? Were they the exact same type of reactions? Were they truly severe? And what were the characteristics of those patients? And certainly everybody is on the edge of their seat waiting to understand that. Hopefully more information will come out from Pfizer or other scientific medical journal published reports and more information. But we don't have any more information other than they say people with severe allergies don't take the vaccine. I think that's what Pfizer put out. So unfortunately, we don't have any more information. I think it's been 24 hours or less since it happened. but hopefully more information will come out about it.
Yeah, we'll know more about it as soon, I think. I would point out that both the people who had the allergic reaction already had EpiPens. They have such an allergy history that they already had their EpiPens. And remember that when you get the injection, when you get the vaccine, and I'm going to line up and get it, and as soon as, again, when it's my turn, I'll make sure that everybody knows, and I know Hawkeye and I have both said, we're going to do it together. Well, gosh, we're going to try and film it so you all see it. But when we do it, you have to have a 15-minute waiting period afterwards where you're observed so that we know that you're safe. And we're equipped as anybody that I think anybody that's going to give a vaccine, we're very equipped to handle any allergic reaction. We're not concerned about that. And honestly, I'm not that concerned about this situation, especially until we know a lot more information, because this was 2 patients who got it when there's been 30,000 people who have been studied, and that the rate between placebo and drug wasn't any different. So let's see how this plays out. I'm not overly concerned about it right now. I think we need to move forward and continue to get vaccines. Remember, ultimately, this is your question. Where do I have the most risk? Is it from getting COVID, or is it from getting a vaccine? I'm going to tell you, there is going to be no question about this. There is going to be far more risk associated with the disease than there is with the vaccine. And that's how I think we have to look at this in life. Senator, anything you wanted to add to that?
Doctor, when this is just my interest, when the vaccination becomes more widespread beyond those in assisted living, nursing home setting, and healthcare providers, how does a person get a vaccine? Will they go to a clinic, or will it be more like the testing that's going on and there's a drive-by kind of thing?
Yeah, I think I can try to take us away. Here's what we think. Right now, we don't have that many vaccine doses available, and it will be a while, probably several months, before we have enough vaccine to really go put it into a drive-by clinic. If things are really safe after the first few months, meaning we don't see these allergic reactions, and we've got a good set of experience where we know how to do this well, we will establish a drive-by clinic. It will not be our first shot at that. Our first thing that we're going to do is have you come in for an appointment, sit down in the office, and we already know where our vaccine clinic's going to be, and you'll get the vaccine, you'll be observed for 15 minutes, then you'll move on. As we gain more experience and we gain more vaccines, we'll start pushing it out to, I think, physician offices, and then we'll start doing a drive-by clinic. But we got to make sure that things are, all as it's supposed to be as we start out, Hawk.
Yeah, absolutely. We've had a history of doing drive-by clinics for influenza vaccine. Overall, we will make them available in our clinics. The good thing, there are vaccines available at pharmacies. Hopefully they will be getting their shipments too, down the road. So we just have more people who have access to those things. But we have been working on that. And eventually, as more people get vaccinated and more supply is brought to the nation, we'll be able to do that in our regular clinics.
My understanding is that Kansas will receive 159,000 doses of vaccine by the end of December, is at least the plan. A lot of logistics to be had, but that again is directed at those in the priority category, which makes sense to me, the healthcare providers. And the folks at Warp Speed believe that Americans would be, they say all Americans would be vaccinated by in 6 months. I don't know whether that's an accurate statement, but that's at least what the testimony to us. And
clearly what we're hearing, we've heard anywhere between May and July, and I think that a lot of that will depend on supply. It's going to depend on if AstraZeneca's get approval with they've had a couple of things pop up, and then Johnson & Johnson, because we need enough doses to do that, and I think that as we get more doses, we'll be able to meet that target. And I think it's a big logistical haul, as you pointed out, because that's 350 million people that have to get a dose of a vaccine in 6 months, or actually 2 doses, right? So that's like 700 million injections. Those are staggering numbers, and but we can do it. Especially if as we gain more experience, we don't have to wait 15 minutes. Then it gets a lot easier, because then we can do drive-by things, and just like that with influenza, that'll speed things up pretty dramatically. I think you'll see a lot of mass vaccination stations and other things. We just got to get the supply chain built up around the vaccine.
Gretchen wants to know, and I'm not sure if you spoke to this, Senator, so forgive me if you have, will there be a continuation of the eviction moratorium?
I didn't speak to that. And again, the final version of this legislation is not complete, but I certainly know that issue is involved in the discussion. So I wouldn't be surprised by what it's included, but it has not, again, there's not been an agreement. There's been give and take that's ongoing. We'll know this answer, I think, in the next few days, but it is a topic of discussion about its inclusion. And just my hunch is that it will be part in some fashion of the plan.
Stephen wants to know about what you think of a cheap rapid home test. I think the FDA gave EUA approval.
They did
to one.
give a rapid EUA, and it's a 15-minute turnaround test. They only had a few kits out. It's not all the way out yet. I mean, it's going to have to build its supply chain as well. And so, Hawk, what do you think?
You know, I think getting these tests out to as many people and having access and accurate results is very important. We know that there are caveats with these antigen tests, these home tests. First of all, it's the operator who's doing the test. Are you going to be able to get a good sample at home? That's important. Certainly, it looks like these are pretty easily obtained samples, so it should be good. But we know that the antigen tests just are not as sensitive. Now, is that because you don't have enough virus to be considered infectious? That is one theory. The other thing is we know the antigen tests don't have an amplification point just as PCR does. So I think there's caveats to these. I think it is one step closer to having better access and more accurate results to testing for the mass general population. But certainly we wouldn't use that as a gold standard here in the hospital. We know that Dr. Leisman is working on looking at antigen tests for use in the hospital here, but just have not been able to land on a specific product yet because we do have ready access to that gold standard nasopharyngeal NP swab PCR test. So I think it's good and it's one step, but you just have to understand and take those results with a little bit of a grain of salt that maybe a negative isn't necessarily a true negative.
And I think the test is slated to cost between $50 and $80 per test. So, and you still have to figure out, you still got to do something to make sure you report the data.
Right.
And because it's important for public health purposes. One more question.
Sure. Virginia is asking if you could please speak to ivermectin as a potential treatment option, and what are the most common treatment options being used right now?
Yeah, ivermectin is not a treatment option. Same as hydroxychloroquine, not a treatment option. A new study came out about vitamin D showing no effect. So we think vitamin D as a supplement in general for your health, if used in the proper doses as stated on the bottles, is fine and healthy, or if it's directed by your physician. But for the purposes of prophylaxis, protection against infection or COVID-19 or disease, vitamin D doesn't work. Certainly we know hydroxychloroquine and ivermectin do not work either. Currently, what is the mainstays of therapy are prior to hospitalization, within 7 days of getting symptoms, the monoclonal antibodies, of which Eli Lilly and Regeneron make two separate ones. If you can get that, that has a potential to keep you out of the hospital. Certainly if you come to the hospital, we have remdesivir. And if you meet criteria, we'll be using steroids, dexamethasone, if you are hypoxic and otherwise meet criteria. And then, of course, anticoagulation. So really the mainstays of treatment are prior to hospitalization, the monoclonal antibodies if you meet criteria, the remdesivir if you are hospitalized. And then if you are hospitalized and you meet criteria, you'll be getting steroids. But you'll also be getting anticoagulation to help prevent or treat any blood clots that can occur, which we know are so common in this disease. Other than that, it's really symptomatic and supportive care with oxygen, Tylenol to help reduce your fever and body aches. But ivermectin has no role, hydroxychloroquine has no role. Vitamin D now is showing to really have no role. And in fact, we really stopped using convalescent plasma either because of several very good, well-done studies which really show no benefit. Although they aren't harmful, it really just hasn't shown benefit for treatment of COVID-19.
All right, Senator, final thoughts from today. And again, thank you so much for being a part of our program.
Thank you for allowing me to join you. Thank you for what you and your colleagues are doing at KU Health System, but also physicians, nurses, other practitioners across Kansas. And we are grateful for the challenges that you are all meeting. And I'll be able to report more on the next phase of our efforts, I hope, in the next few days. The Senate is staying in session for a day or two, seemingly extra, as we kind of sort this stuff out. And I hope that we can do something that improves people's health, get people where they know they're healthy, keep the economy going, people out and about. And I'm delighted to join you on a day in which we can celebrate a vaccine in the next few days being being in our state and at least available to begin to be available to some in our state. Great stuff. Thanks.
It is great stuff, and thanks again for being part of this and for the great efforts you've had for Operation Warp Speed. And again, to borrow from the Star Trek lexicon, live long and prosper for all of us. Hawkeye.
Optimism right now. Again, we have really just on the cusp of starting to be able to distribute and give vaccination. Hopefully, we will get our supplies, get more supplies, be able to vaccinate more and more people. But I think right now we should really have a lot of optimism. Yet, we need to be cautious as well because we know that our patients in the hospital are going up. So it's a little bit of both, but really the optimism with the vaccine.
Yeah, it is really good optimism. Hey, tomorrow, Tim Williamson, our VP of Quality and Safety, joins us to talk a little about our preparation here at the health system to receive the vaccine. We're going to be able to review vaccine questions and answers from the week as well. We're also keeping track and updating our vaccine page on the health system website. It's a great place for information. You can also find the information on the FDA, HHS, and CDC websites as well. Want to stay, also just to note that David Weil will be sitting in my chair for tomorrow. I will not be here, but Hawkeye will be back and the team. Thanks to Georgianne for setting the example today of how to connect with family this unique holiday season while staying safe. These are pics of their Thanksgiving celebration, which included Zooming with sisters and cousins from all over the country. Georgianne says she always wears her mask, even when cooking and when visiting the cancer center here in Westwood. The porch pic is from earlier in the year where visitors were reminded to keep their distance. You know, this is the beginning of the end, right? We hope it's the beginning of the end of the COVID pandemic, and it's the end of the beginning when we didn't have the vaccination. So I think today will mark a special day in the history of our country, and especially in the battle against SARS-CoV-2. Please follow those pillars of infection control. Remember that the vaccine is only complete when you wear your mask, keep your distance, wash your hands, stay home when sick, and really love thy neighbor. Because when you follow the pillars, that's what you're doing. We're back tomorrow. We hope you're with us. Thanks so much.